Okay, and welcome to my study series on cardiology. We're going to be looking at some cases, some simple cases, some typical cases. I'm looking at the first aid casebook, in case you're wondering. So here's the case. A 13-year-old adopted boy is brought to the pediatrician by his mother, who reports that he hyperventilates and becomes blue around his lips and in his fingertips after crying, eating, or any exertion. She has also noticed he tends to squat when he gets these symptoms, which causes him to pink up again. What is the most likely diagnosis? Tetralogy of Fallot, or Fallot, or however you want to say it. Cyanotic congenital heart disease known as blue baby syndrome presents as dyspnea on exertion, such as feeding or crying. Exertion results in systemic vasodilation, which lowers left-sided resistance, thereby increasing the right-to-left shunting of blood. Right-to-left shunting of blood, not left-to-right shunting of blood. Bypass of oxygen exchange in the lungs causes hypoxia and cyanosis. Squatting significantly increases systemic left-sided resistance, reducing the amount of blood shunted and alleviates symptoms. So the next question is, what anatomic findings are characteristic of this condition? So looking behind me, what do we see? We see a boot-shaped heart. So what do we see? Move around here. We see pulmonary stenosis, right ventricular hypertrophy, right ventricular septal defect, overriding aorta, displacement of the aorta over the ventricular septal defect. So the anatomical findings in TOF are as follows. Pulmonary stenosis, 1. Right ventricular hypertrophy, 2. Overriding aorta, deviation of the origin of the aorta to the right, and ventricular septal defect, VSD4. And the mnemonic here is PROVE, P-R-O-V-E. So P is for pulmonary stenosis, R is for right ventricular hypertrophy, and O is overriding aorta, and V, ventricular septal defect. So that's your mnemonic. Next, which developmental defect is responsible for this condition? In TOF, the infundibular septum, the portion of the septum adjacent to the outflow tracts, is anteriorly and superiorly displaced during development, leaving a hole in the ventricular septum. This displacement also causes pulmonary stenosis by blocking flow to the pulmonary artery. The result is increased pressure on the right side of the heart and right ventricular hypertrophy. Okay, and next, what is the characteristic radiologic finding in this condition? X-ray of the chest typically shows a boot-shaped heart due to right ventricular hypertrophy and the absence of a pulmonary artery shadow above the left side of the heart. An echocardiogram with Doppler mode shows the altered pattern of blood flow. What additional physical finding is commonly associated with this condition? Clubbing of the fingers may appear in adults, secondary to chronic hypoxemia. It is believed that the lungs secrete growth factors in patients with chronic hypoxia, resulting in abnormal tissue growth that first becomes evident in the distal phalanges. So there you have it. So try to remember all those things for tetralogy of Fallot. And that is your lot.